Hi, this is Dr. David Warwick, your local Lacey Olympia Chiropractor. Today we're going to talk a little bit about where does back pain come from. Um, you will experience or suffer back pain at one or more times in your life, and many of us feel back pain coming from something that's of a physical task, whether it's working in the yard, picking up a box, whether it's shoveling, digging something, washing the car, or even cleaning the house. It could be a number of things, even bending in the shower or doing nothing sometimes. Many times these are not always easy, and there's no direct way of finding out where it's always coming from. But there's a process that we go through in assessing, whether it is not so much a direct link to the actual problems. Many times that we see are what's called micro traumas that happen and occur, and it's an event. Many times people come in and they say, I don't know what I was doing, I don't know what happened, and it could be age related, but here it is. This is what I share with a lot of my patients, is that it's a straw that broke the camel's back. It's not the single straw, it's the whole hay bale that's been built and leveraged on that camel's back. So it was just that final thing that put it in and made it more difficult on that. Some of the more or less identified causes of back pain are referred pain, and that's where you may have a facet or a joint, SI joint, or even a disc tear, and that is typically what we see and we call a sclerotogenous type pain. That is a lot what chiropractors work with. There's also a visceral somatic response, or VSR, and that's where there's internal organs that are referring pain. For example, the classic one is if you have right shoulder pain, or right at the right shoulder blade, that kind of pain that could be referred from the gallbladder. Some other areas or organs that can, in those type of things, let me backtrack, needs further testing, and chiropractors are trained to assess that. If it's a musculoskeletal condition, which is your typical pain, or if you're having another diagnosis that may be needed, such as ultrasound, CT, MRI, and other diagnostics. And chiropractors can assess and make a judgment call in helping you move in the correct direction of that. So with also the visceral type pain pathology, for example, the heart, typically you'll hear about the left chest, arm, as well as the upper back and left jaw. Liver would be your right arm, right upper shoulder, front and back, as well as the right middle to low back, just below the sternum. Your appendix, right lower abdomen, like way down low on the right lower quadrant right there. Small, the small intestine, either side of the umbilicus or belly button, as you call it, and in between the breastbone area. Kidneys, the small of your back, even your upper thoracic area, or your upper tailbone area, into the groin can be a referral pain from kidney problems. Bladder, just over the pubic bone, or just bilateral, both sides of the buttock area, just above that. Ovaries in the groin, umbilical area, and of course the colon area, which can affect the mid-abdominal area, as well as the lower quadrants, or the lower area down here. So another challenge, and the one that not a lot of us like to talk about, and that, thankfully we don't see much of it, is the challenge or diagnosis of cancer of the spine. Usually we'll see, and while this is extremely rare, this is where there's a history of unexplained weight loss, past history of cancer, over the ages of 50, nighttime sleep, so deep pain or pain that's occurring at night. And so this kind of thing, this kind of diagnosis, obviously you want to have certain tests to assess and see, the proper referrals that need to be made. Bottom line, Chiropractors have been trained to work with back pain and help you with from the usual suspicious ones to the very unusual ones, either through simple testing like orthopedics, or even into other diagnostic tests to assess and properly treat people and get them to the place they need to be. Of course, you have an option to see other providers, but when you're experiencing any kind of back pain, you want to go to a provider when you can assess or do some immediate care in a very short period of time, such as one of the examples I gave in my video of tip number 1, 2, and sometimes 3. I'm Dr. David Warwick at Warwick Chiropractic. You can go to my website, drdavidwarwick.com, or even visit my blogs on my homepage or my other blog page, drdavidwarwickblog.com. My office number is 360-951-4504.